Okay, hello everybody. My name is Jessica Trimble and I am the Director of Communication and Outreach here at Indiana Disability Rights. And today on our virtual interview platform, we have Melissa Keys. Hey Melissa, how's it going?
Good, good.
So Melissa, what is your role here at IDR?
So I am the agency's executive director.
And how long have you been working in disability rights?
Oh gosh, I have been working in and around disability rights issues for about 20 years now.
So you've been doing it for a little bit,
Yes.
So in your 20 years of working in disability rights, have you ever worked during anything like COVID-19?
No, I am happy to report that this is my first pandemic. So it's interesting to navigate, that's for sure. Definitely a lot of issues for our community to consider.
Right. So I do want to share with people a little bit about, or have you share a little bit about what the executive director does. I think what we could call in maybe traditional times. And then, I mean, obviously you're responsible for the same things, but it's kind of appearing a bit differently through COVID. So can you just share a little bit about what you do as the executive director of Indiana Disability Rights?
Right. So without a pandemic, normally my role is very much to make sure that staff have what they need, that we're staying in compliance with all of our federal rules and requirements and state rules and requirements, and that we're providing the best services that we can to the community that we serve. Now that part hasn't changed during the pandemic, but now I am also looking at PPE procurement and managing closed offices and remote workspaces and things like that. So definitely new challenges, new things for us to keep our eyes on that impact our community, and just making sure that our staff and the people that we serve have what they need to feel safe during all that's going on.
And something I do want to share with everybody watching the interview is you and Tom Kershaw, our legal director, you have been on multiple conference calls a week at the federal and local level and state level, just seeing how COVID is progressing, how it's impacting our communities, how it's impacting services. Can you talk a little bit about that process and kind of what you've been having to do just to stay abreast of the day-to-day changes?
Right. So we have been experiencing all kinds of changes and new information from the local level to the state level to the national level. And we are absolutely trying to monitor that so we can make sure that issues that are important to our community are being addressed, and that the voices of people with disabilities are being included in those conversations and those planning issues. So we are monitoring all kinds of things at all these different levels to make sure that the voice of people with disabilities is being included and heard. But it just seems, every day there's new issues that crop up. These issues will continue long after the pandemic itself has subsided. There's going to be all kinds of repercussions that we're monitoring from this as well. And so just trying to stay on top of everything has led to lots of webinars, lots of phone calls, lots of conference calls, that type of thing, to make sure that we are aware of everything that's going on. But part of that also means that we are really seeking information and input from the people that we serve. So if you are a person with a disability who's experiencing issues related to accessing medical care or rights violations, whether you live in an institution or you live at home, if you're concerned about things like special education, discrimination in the workforce, housing opportunities or eviction issues, please make sure to give us a call, because even though our physical office space is closed, we are still here to help, and we are still taking cases, and we are still very much interested in hearing from our community about how COVID-19 has been impacting everybody's day-to-day life.
Well, that was a good segue to my next question is, even though our physical office looks a little different these days, IDR has still been working the whole time. We have not stopped. So can you talk a little bit about how our work has been modified, or what creative things we're doing to still make sure we are doing what we are expected to do, but just in a little bit of different ways?
Right. So we are still taking individual cases. Not a whole lot of that has changed. So people who are experiencing discrimination or rights violations, or feel that they are experiencing abuse, neglect, or exploitation can still feel free to call our office. They'll still speak with an intake coordinator who will gather their information. The case will still be reviewed by our staff. And so cases are still proceeding. Now, one of the other great things that we do is monitoring and investigations, where our staff actually go out to facilities, talk with people who live there or receive services there to make sure they're getting everything that they need and that they feel safe and comfortable with the services that they're getting. Now, obviously, the in-person monitoring and investigations has changed somewhat during the shutdown and during until we can get adequate supplies of protective gear for our staff. But we are still doing what we can to connect remotely with the people that we serve. So a lot of our advocates are calling facilities, talking with residents, talking with staff, connecting with family members. We're trying to do this virtually, either over video conferencing platforms or over the phone if that's the only thing that's available. We're really doing our best to try and connect with the people since we can't physically be there in person right now. And hopefully, fingers crossed, as we can get access to PPE, we can start to open that up where we can go out and make in-person visits when it's safe to do so, both for our staff and for the people that we serve.
So kind of touched on this a little bit earlier. So we've talked about how things are different, but how are things the same? How are things the same at IDR with our staff?
Well, number one, we still have an amazing, dedicated, passionate staff that is here and ready to answer your questions and here and ready to provide services that to the best extent that we can. So our core services aren't going to change. The people aren't going to change. So we are still here to provide that information. We're still here to connect you with resources. We're still here to help answer questions that you might have, help you learn more about the issues that are impacting you. So a lot of that hasn't changed, just our physical office and our ability to meet one-on-one with clients and things like that.
So what are some of the new issues or issues that really came to light because of COVID-19 that IDR has been working on?
Well, we have obviously been working a great deal in access to healthcare, both with looking at medical rationing policies and guidance, making sure that policies have adequate visitor policies to allow adults with disabilities who might need a caregiver to attend appointments or visits with them, making sure that there's access to effective communication in hospitals, as well as from public health officials during their daily updates. We've done all kinds of things, making sure that students who are remote learning have access to what they need to still receive that free, appropriate public education. We are also looking at policies and practices in institutions, trying to better understand what their plans are to protect against outbreaks, or how they plan to protect people, as well as continue to provide services so that we don't have increasing symptoms due to isolation, things like that. We have some great dedicated staff, people who are focusing a lot on the census and voting issues. Indiana's primary is coming up in less than a month. And so trying to get information out there to people about what their options are for voting in that primary, voter registration, absentee ballots, things like that, as well as continuing to encourage people to complete their census and just make sure that people's questions as it relates to this pandemic, that we are being responsive. And number one priority is to make sure that when these discussions are happening at the federal, state, and local level, that we are trying to amplify the voices of people with disabilities and make sure they're being heard and that their issues are being considered and acted upon.
And something that I will share in the comments in this video is a link to our COVID-19 website or web page we have for Indiana Disability Rights. On there, it lists a lot of what Melissa has just shared with us, what issues we've been working on, also links to vetted credible resources with COVID-19 information. So we will make sure we share that resource with everybody. We are updating it all the time with new information. Because that's the thing with COVID-19 is it's changing constantly. So please note that we are still looking at things. If there are issues that have been coming up for you in your personal life, you know, if you're having issues or you're feeling discrimination because of your disability, people should keep calling us, right, Melissa?
Absolutely, we're here to help.
So, gosh, Melissa, is there anything else you want to share about IDR or what's been going on or what you want people to know?
I really want people to know that we are still here, even though our physical office space is closed. We are still answering the phone. We are still responding to letters. Our attorneys are still working. Our advocates are still working, and we're here to help. So if you feel, you know, that your rights are being violated or that you're being discriminated against, or if you just have worries and concerns and need help connecting to resources, please feel free to give us a call. That's what we're here for. We're here to help. And, you know, trying to balance continuing to do the mission that we're aimed at doing while balancing the safety of our staff and our clients is of utmost importance. So we appreciate everybody's flexibility and everybody's willingness to understand why our physical office space is closed and why we have made the changes that we've made, and know that when it's safe to do so, we will absolutely be back in those facilities